back to Daytime Ottawa here on Rogers TV. Well, as promised, entered the building. Well, she had something pretty big to bring along with her here today because we're going to be talking about Bowen therapy. More importantly, talking about insomnia. Welcome to the show. It's great to have you here.
Hi, Doug.
I think a lot more people suffer from insomnia and don't even realize they're actually suffering from a condition like this.
Exactly.
How prominent is it really in society?
Well, really, everybody at some time in their life does experience insomnia, but in terms of statistics, it's really quite high. It's 60 to 70% of people experience it at some point.
I have a question.
Yes.
Because I do. Derek is right. I mean, it seems like every once in a while I will just go through the worst bout of insomnia. Does it have anything to do with the moon phases? Because that's what I was told one time.
It can. It can. Absolutely. Okay. Yes. I mean, most significantly, insomnia has different categories. And first of all, people will typically have troubles falling asleep. It'll take, 15 minutes and then it'll all of a sudden extend to an hour. And then they have difficulty staying asleep. And what happens is they wake multiple times throughout the night. The third type is people tend to wake early in the morning, say 3 o'clock, 4 o'clock. And what happens is relating to the moon cycle is that our hormones relate to the moon cycle. And so there is an explanation. It's not just...
It's not a myth.
No. What happens is if you look at the newsletter, there's an actual graph of it. But cortisol normally should rise about a half an hour after waking, dips a little bit after lunch, and then naturally fall down as we're getting ready to sleep. And what happens in those people that tend to have creative energy at night is their patterns are exactly the opposite. They'll tend to be lower in the morning, they'll tend to be slower to rise, and then all of a sudden 3 o'clock, they're hitting their peak energy, and then it's never really falling off, and it's cycling throughout the night.
So what are, moon cycles is one. What are some of the other symptoms causing insomnia for people?
Sure. Well, insomnia in terms of symptoms can be certainly cascade into other symptoms, fatigue, headaches, memory, aches and pains. Some people don't realize that it's definitely related to aches and pains, and then other things can cascade from that.
Okay, now, what about causes? Because one could possibly be moon cycles and your hormone fluctuations.
Yes.
Are things that some of the other things that are coffee, booze, sugar,
lack of exercise. I mean, the most common things that we think about for lifestyle, but then we start getting to more serious concerns that we should be thinking of, perhaps hypoglycemia. Perhaps your blood sugar is really low at multiple times throughout the night and you're just waking up. Perhaps, again, it's a hormonal issue, and that tends to impact the bladder and bladder control. So that could be a relationship.
I'm surprised I don't have insomnia.
No.
After you just listed off something.
I'm surprised you don't either, because really, you think you would. And also stress, too, because what I find is my mind, I can't quiet it. It just races. I just want to get up and start doing things, and I just can't relax.
So one of the most simplest things we want to encourage people to do is think about a 2-hour wind down time. Because most people think, I can do some computer work and then 15 minutes just hop right into bed and go right into sleep. And unfortunately, as we get older, that just doesn't happen. So we want to think about shutting off the computer perhaps 8 o'clock and then heading into bed around 10 o'clock.
Well, let's talk about treatment, because one of the treatment options is Bowen therapy.
Exactly.
TL is going to get on here. While TL's getting ready for her Bowen therapy, she won the arm wrestle. No one's surprised to hear that. Look at the size of me. While TL's doing that, explain, what is Bowen therapy exactly?
Okay, so Bowen therapy is a musculoskeletal technique in which we're rolling over certain areas of muscle tissue where there's a high concentration of communicating proprioceptors. And by reacting in a particular location, we get a therapeutic response for that muscle belly to release and relax, thus promoting optimal levels of actin and myosin in the muscle tissue itself.
When somebody comes to see you for Bowen therapy, will you explain that to them in English?
Yes.
Okay, good.
Do you know what I was just thinking about? I didn't understand a word she just
with
said.
the Kemp and the things.
Okay, very simplistically, your muscles are like a guitar string. If they're strung too tight, you'll have problems. If they're strung too loose, you'll have problems. So what we're going to do is we're going to help reset them to their optimal tension.
All right. Let's tune her up.
Okay.
Am I in the right spot?
You are perfect. You are perfect. So we first of all make sure the patient's really comfortable, and then we start in the low back region, about L4, L5, and we use a little bit of a pressure technique to roll over the paraspinal muscles that are supporting the low back here. And then we head to the bigger muscle, the gluteal muscle, and we go right to the belly of the muscle, and we create a little bit.
I should point out most patients don't have a microphone pack on their back either, so it makes it easier.
You know, Dr. Joelle's pretty tiny, but she's got quite muscles there.
So, as far as doing the therapy itself, how long would this last? How often would somebody have to come and see you?
The treatment itself is 30 minutes, and it can be 40 minutes as well. And in terms of the therapeutic effects, the great thing of Bowen is it can last many, many months.
Okay.
One treatment can have profound effects. It really can. If you're an individual, though, that has a lot of repetitive movements, you're doing the same kind of computer movement every day, you might need a maintenance of once a month.
Okay.
But very, very effective.
Dr. Joelle, just from like those couple of things that you're feeling there, what am I telling you?
So basically, your paraspinal muscles are fairly tight, your gluteals are fairly tight. So then as I move down here, I'd look at the tensor fasciae latae, which joins this area to this area, and probably your hamstrings would need some work as well. And I'm not sure if you're a runner, but that's a very common area for people who are runners.
I do run
tension
often,
in that area.
One more quick question. You always come on and advise people to eat certain foods or maybe take certain supplements. Are there some out there that can help people with insomnia?
Yes, definitely. Well, actually, your mega oils can be very, very helpful because they promote optimal.
So walnuts are good.
We planned that.
Exactly.
We planned that.
Yeah. But magnesium-rich foods, which also can be found in nuts, seeds, etc. Magnesium helps to relax smooth muscle, and so if a person is deficient, they might be having symptoms of insomnia, muscular tension, difficulties with memory and concentration. So magnesium-rich foods are excellent. Calcium-rich foods. Carbohydrates about 2 hours before bed with a touch of protein can also be helpful.
Fantastic. And if you want more information, visit because you can sign up for her newsletter. She covers so many different topics that will help you out. Listen, don't go away. Thank you so much for being here. We're going to be back with the man himself, Mr. Opinion of Canada, Rex Murphy, right after this. Don't go anywhere.
I'm just going to hang here. Do you mind?
Yeah? We could do that.